which is inevitable in any given organization or business. And there are barriers and drivers or enablers of change, which ensure success or failure of any change initiative. According to Jacobs et al. 2013, the success of any change initiative is based on the drivers such as the environment, stakeholder support, the good planning, as well as implementation and good leadership. These will ensure that the change initiative is a success. This report is based on the change initiative return to office that happened at the organization where I work, the Riverina Aboriginal Medical Service. This is, of course, not the real name in order to maintain privacy and confidentiality for the organization, but the gist of the report is actually based on what happened during the transition back to the office. The change manager had a transition plan, which was as follows. Communication. This was consideration on how to communicate the imminent change to staff and stakeholders. Showing empathy. This is because people had been impacted negatively during the pandemic. Some had mental health issues, others were still sick, and some had to change their lifestyle and accommodate kith and kin who had been under lockdown and could not travel back to their areas of abode. Packaging the right messages for different employees, of course, considering individual differences. Packaging messages to clients and stakeholders, including the funding bodies, that is to prepare them for the transition that was going to take place. Then the other consideration was workplace facilities and technology, that was ensuring that there would be safe distancing between employees and visitors in order not to spread the virus. Managing safety, managing safely the coming and going of people in and out of buildings, because this was going to be a new situation and a departure from the old order pre-pandemic. Planning for new technology and hot desking, as well as meeting rooms. Of course, implementing the safety considerations. Planning the gradual opening of offices to ensure that people did not all return at once. This had to be safely managed. Determining which employees would return to the offices first and who would be the last, and what would be used in the process. Then another part of the transition plan was consideration of health and safety. This looked at monitoring and maintaining appropriate social distancing, establishing strict cleaning and sanitation procedures, provision of personal protective equipment, transition from telehealth to direct contact with the clients through home visits. Because home visits had been suspended because it was risky to the therapists and other workers to be going into people's homes during the pandemic. Also, the government had stopped that because there were strict lockdown rules that were to be followed. Then ways to further support remote working for those still needing it. The next consideration on the transition plan was stakeholder involvement. This included the final approval from the RAMS board after the CEO's endorsement of the plan. Then funding partners, mostly the Department of Communities and Justice, DCJ, had to be kept informed also in consideration for possible support with more funding. Was the change effective or not effective? Change was not very effective as it was not communicated very well to the staff. It was done in the form of a directive which was delivered through an email. There was no consideration for staff's individual situations. There was no appropriate consultation of staff and stakeholders before drawing up the final draft plan. Many people were not given time to readjust their lives to prepare for the change. And there was no room for staff to give feedback or input. The difficulties that people faced during the pandemic were not acknowledged. The implementation was sudden and not gradual. It was random. What I could have done to make the change effective? I believe that communication is key to facilitating change. I would have communicated the change plan clearly to the staff. Instead of a directive, I would have made it more consultative in order to get a buy-in by the staff and key stakeholders. I would have considered staff's individual situations, for example, those that did not want to be vaccinated but wanted to return to the office. I would have checked with the policy as well as senior management like the CEO and even the board to find out what could be done in order to have a win-win situation for these key staff members. The pandemic affected people's minds and emotions as well as their lifestyles. I would have given them time to readjust their lives to prepare for the change. So instead of making it sudden, I would have made it very gradual. I would have acknowledged the difficulties that people faced during the pandemic and therefore showing empathy. And this would definitely motivate the clients and to know that the workers or employees and to know that they were valued. The transition was not very effective because the plan was not followed to the letter. I would have made sure that after all the consultation and having a good draft change plan, I would have then gone ahead and implemented it gradually and to the letter. The values at RAMS that facilitate change. Among the values that would help facilitate change at RAMS are respect. RAMS values respect for everyone, including the board, the elders, the members of the community, staff, as well as clients and visitors, acknowledging that everyone is different. Accountability. Being accountable to self, to the community, to stakeholders, to clients, and to the funding partners. Humanity. Valuing the person as a human being, regardless of their socio-economic status, ethnicity, age, race, or any other criteria. Cultural identity. Embedding culture into practice and embracing cultural diversity. These are values that would help facilitate change at RAMS. Concerns around the change. RAMS is an Aboriginal organization with more than 60% of the staff identifying as Aboriginal and 85% of the clients also identifying as Aboriginal. The ethical concerns arising during the change were that people were generally felt that there should have been wider consultation before decision was made. Aboriginal people are mainly classified as being vulnerable, and during the pandemic they were given priority to receive vaccines. Some of them did not want to be vaccinated due to the lack of trust for any government interventions against the COVID-19. Would they then be allowed to come back to the office? That was one question that needed to be resolved.